Hello, my name is Mackenzie Reeves, and I did my quality improvement project on communication among the healthcare team. I chose to use this topic for my quality improvement project because there is currently decreased communication between surgeons and preoperative nurses at the hospital that I work at. This can lead to a multitude of risks, but I'm focusing on the risk of patient harm and excess stress for nurses. It is known that communication failures are a lead cause of patient risk in the operating room. This is due to the methods of communication between physicians and nurses. Decreased communication between surgeons and nurses negatively impacts the hospital organization, patients, surgeons, and nurses. So what is the current method of communication? The current method of communication at the surgery center is only face-to-face communication. This causes several problems listed in my fishbone diagram here, but I'll be focusing on just a few. The first is that there are multiple surgeons performing different surgeries. There are multiple nurses, multiple surgeons, and multiple patients. This leads for a hectic environment, and having only face-to-face communication does serve as a problem. There are different preferences for each surgeon, so the nurse must communicate with the surgeon to see what the surgeon wants for that patient. There are several contraindications for surgery. This includes metal implants, blood sugar, blood pressure, and more. So some patients and surgeons will go ahead with surgery, and some surgeons will cancel surgery. So it is important to communicate the contraindications to the surgeon. Locating surgeons. Oftentimes they are not yet at the facility or they are not at the nurse's station, so face-to-face communication can be very difficult. Time restraint. If surgery is not started at the desired start time, the facility is penalized for this. So communication often gets on the back burner for face-to-face communication. But if communication was allowed through technology, this would be a lot better. Environment. It is a very hectic environment. It is hard to find the surgeon and it is very loud. So this makes face-to-face communication difficult. Evidence of the problem. Failures with communication have shown that there's a higher nursing staff turnover, a higher patient mortality rate. The patient has to stay in the hospital for a longer amount of time, and they experience greater post-operative pain. There is also a significant relationship between nurse communication satisfaction and the quality of patient safety culture. Improving the effectiveness of communication among caregivers was added to the 2024 Joint Commission goals. In the past year, there's been 2 patients that have made it to the OR with severe contraindications. This can include something like metal implants, and this can be very detrimental to the patient. If there was effective communication, this could have been caught before they made it to the OR. 70% of the preoperative nurses have reported unsatisfaction with the current means of communication. The current process, I would like to focus on the bottom. It is the surgeon present while the patient is in pre-op? If the surgeon is present, face-to-face communication will take place. If the surgeon is not present, the nurse has to let the patient know that they will talk to the surgeon when they arrive. This leads to patient dissatisfaction. It also leads to risks such as medication contraindications being missed, leads to a rushed environment, and ultimately leads to a decrease in patient safety. The aims for the quality improvement project are that by December of 2024, Osher Medical Complex The Grove will improve communication between surgeons and pre-op nurses. We hope for lower near misses or contraindications that make it to the OR. We hope that nurses experience less stress in the facility and that patients report higher levels of satisfaction on their surveys. This will be based on the teamwork and satisfaction of patient-centered care. Also aim to use the Epic Secure Chat feature available in Epic, proper documentation of this communication in Epic, and staff compliance for the implementation. So what is Epic Secure Chat? Epic Secure Chat allows for the nurse to communicate with the surgeon or any other healthcare team member on the computer. This allows technology to be used for communication so that if face-to-face communication is not available, there is another means of getting in touch with the surgeon. At the top, I have an example of a fake patient scenario. It allows the nurse to attach the patient's electronic medical record to the top and allows the nurse to type out a chat. This will let you know when the surgeon reads it, and it will also, they can send a response. This allows for efficient communication. There's just an additional way of communication. Here I have the Epic documentation. It allows the nurse to write out the reason for the communication, the provider name, their role, and the method of communication, whether this be face-to-face or through Epic Secure Chat. This will allow us to measure how often nurses are utilizing the Epic Secure Chat feature. The plan for the quality improvement is that this project will take place over 12 months. The nurse supervisor will educate the staff on risks of inefficient communication. Will educate on why face-to-face communication might not work. And this will all happen during the monthly unit meetings. An Epic support team member will be present at one of these meetings to educate the staff on the proper use of the Epic Secure Chat feature, and they will also teach them how to document it properly in Epic. Measures for the quality improvement plan. The nurse manager will evaluate staff nurse compliance and satisfaction by conducting frequent rounds and talking with the staff. Patient satisfaction surveys. We use this a lot at my place of employment to see how the patient views teamwork and collaboration. The OR close catch rates. This also is the contraindications that make it to the OR. We hope that those decrease with the implementation. And Epic charting documentation. For implementation, the new communication method will be conducted over 3 months. This will allow the nurses to ease into this change and it will promote compliance and trust. It will also allow the nurses to be educated on why communication is so important. It will allow them to become familiar with the documentation and the Epic Secure Chat feature. The nurse manager will take notes on how well this implementation is going. The nurse manager will talk to the staff and the surgeons to get feedback. And for nurses, leader visibility during rounding has been shown to directly affect retention, recruitment, engagement, and staff satisfaction. The two main goals for this quality improvement project is to increase patient safety and nurse satisfaction. The measurable outcomes I have here at the bottom, it is shown Q1, Q2, Q3, Q4. This represents quarters as Ochsner is a quarterly facility. On the left-hand side, you will see percentage of nurses satisfied with surgeon communication. Since it is shown that nurse satisfaction is directly linked with patient safety, I chose this route. It is currently at 30% satisfaction, and by Q4, I hope to reach 70% satisfaction with the implementation of Epic Secure Chat. Here are my references. Thank you very much.